So today we have Dr. Louise Achey with us to tell us about her book on how to take medicine safely, why dogs can't eat chocolate, and also to get a demonstration here on how not to overdose or why people get themselves in trouble. Dr. Louise, welcome. Thank you for coming.
Thank you, Linda. I am so happy to be able to explain and demonstrate to you how people unintentionally can overdose on prescription medicine and possibly injure themselves or possibly die. This is not as hard to do as you might think. And today we're going to see how easy it can be to do it. So hopefully we'll be able to avoid that kind of outcome. Okay. What I have here is we have a pitcher of water with colored water because that represents medicine, let's say pain medicine, okay, in there. And pain medicine, what goes in has to come back out. And there's two ways it usually comes back out. It comes back out through the liver transforming it, detoxifying it, and it eventually goes out, usually in the urine.
Okay.
Some people can really eliminate this stuff very quickly, and I use this larger funnel to demonstrate a person who can easily get rid of this medicine. But some people have a smaller capacity. They're either a smaller person or their liver is not quite as efficient at getting this drug detoxified and out of their body, and that's the smaller funnel. Okay? As we get older, our funnels get from this size, they shrink down. So as we get older, we're more likely to have a problem with too much medicine rather than not enough.
Okay.
So I would like you to go ahead and pour some water through that smaller funnel to give us an idea of how medicine is getting out of the body.
So you tell me when.
Just go ahead and pour. Okay. Now notice that if you pour fast enough, it'll go up the funnel. Okay, go ahead and stop.
Oh, okay.
Now it's going to get out of there. Go ahead and try the same thing here.
So to fill the funnel is what you're saying up
Just
to the
go
top.
fast and go. That's enough. And so now it's going to take it. See if what it represents is taking more and more and more medicine in.
Okay.
Eventually, you get to the top of the funnel and you get too much medicine for the capacity of your body to get rid of it. Too much in, not enough out.
Okay.
Okay.
Gotcha.
Now, medicine by itself is usually not the problem, one medicine. It's the interaction when you add something else that usually is the trigger to the overdose.
Okay.
What I have here today is some marbles, and these marbles represent interacting medicines.
Okay.
Okay, so I'd like you to take some marbles and put them in the funnel. What these medicines do is they interfere with the body's ability to detoxify.
Is that enough?
Yeah, that's enough.
Okay.
And then this big white one,
Yeah.
I want to mention that although alcohol is not a medicine, it is a big player in how your medicines can get out of the body. Alcohol can interfere with your body's ability to detoxify medicines. So it is a dangerous thing to mix with certain medicines. So I'd like you to put that in that funnel there. Okay, and maybe just a few more marbles into the bigger funnel. There.
Okay. Out of place.
So you know how fast it took to get the water to go up to the top of the funnel before.
Right.
I'd like you to pour it in again and see the difference.
Okay. And just pour fast?
Whoa, boy, that just didn't take much, did it?
No.
And it's just sitting there and sitting there.
Yes. And bubbles are coming up.
Eventually it will get out. But that's what happens when you have interacting medications. It takes a very long time for those medicines to leave, and it can easily lead to overdose. Go ahead and pour through here. This is a bigger funnel to start with, so it isn't as dramatic.
Wow. That's really fast compared to this one.
Mm-hmm.
This one's just dripping.
Mm-hmm.
Wow.
So the smaller your capacity is to begin with, the more these medications can interact. And you won't notice it until you add the other medicine. Also, you may notice that if we took some of those marbles out, it would flow much better.
Right.
So what happens is if you have just a few marbles, you may think, oh, I can combine those two medicines, no problem. And then one day you take and put a little bit more, and that little more, just that little tiny bit more is what blocks the whole thing up. And then you have the overdose. You
So
go to
it's-
sleep and you don't wake up.
So it's kind of like the straw that broke the camel's back, so to
Yes.
speak.
Yes. The
Gotcha.
difference between being able to function and being on 2 different medicines and that little bit is that's what we're doing here.
Gotcha.
Unfortunately, you can't look at somebody and say, okay, one more medicine, one more is all it's going to take. We can't tell by looking at you. And so it's very, very, very dangerous to combine medications and to escalate the dose.
Gotcha. Wow, that's amazing. This one's empty?
Yep,
This
finally
one
drained,
is-
and this one's still
Dripping.
dripping.
Okay. So Dr. Louise, I thank you so much. Is there anything that you'd like to give us in conclusion?
If you have any other questions, you can go to my website, askdrlouise.com.